Once again, we are with Dr. Mazzarella at Gold Coast Orthopedic Spine and Hand Surgery. We're here to talk about, of all things, the toes that a lot of people have problems with, and also some techniques that Dr. Mazzarella is doing that are faster and less painful and with quicker recovery, correct?
Correct.
All right, explain problem number one.
Well, the easiest thing to talk about would be first a hammertoe, which is where the toe becomes somewhat contracted.
Due to?
Well, in women, predominantly it's from wearing high-heeled shoes.
Okay.
And there are techniques where we can relax the toe with using no stitch at all. Just a splint for 2 days and a bandage.
Wow.
Small bandage where they can walk
A lot of
in
people
the same shoe.
Do people usually try to do surgery with that?
A lot do. In older patients, it's a technique that's preferable as long as the toe is still somewhat flexible.
But your guys' philosophy is less
incision is better than longer incision.
So even if it's a little less money on your end, you'd rather have the patient have the least amount of pain, basically. You're not going to force them into surgery just to get them...
no, if they don't need bony work, we don't do bony work.
That's a good thing. Okay, problem number two with the toes.
Again, the bigger problem is that of a bunion, which is a protrusion off the, let's say, the large toe, the great toe joint.
Do they have minimally invasive techniques to fix these?
There are techniques where there's longer incisions.
The old way.
The older way would be with using a plate and a larger cut through the bone to reduce the bunion.
Okay, the minimally invasive way, the better way, the way that we want everybody to come get done because we want them to be up and at it.
Would be with more of an incision toward, cut more in towards the toe itself and the forefoot, so that we can realign the great toe joint, utilizing a smaller incision with less bony work, which allows the metatarsus to heal more quickly.
Less scar tissue, the better always too, isn't it?
Less complications.
Less infection.
Less infection.
A lot of risk in the feet with infection, am I right?
Well, they can be slower to heal, so the less bony work we have to do, the better.
Yeah. And then people that are like diabetics, or they have, say blood issues or other types of problems, this might be a better way for them.
Possibly. Depends on the patient.
Okay, Dr. Mazzarella, is there anything else you'd like to tell us? Or we're done for the day? Okay, great. Once again, Gold Coast Orthopedic Spine and Hand Surgery with Dr. Robert Fink and Dr. John Mazzarella, talking about the better way to do things, I think. And I'm sure you will too, once you don't have to go and sit in the hospital for a couple days after a technique that you could walk out of their office getting.